Hello, it's Kathy Go here, and I am to talk to you today about concepts in chronicity. So, I wanted to just sort of initiate this discussion by saying that the idea here is there some theme process. In this term, we're going to be coping with chronic illness or learning about chronic illness and how people cope and nursing strategies to help people cope with chronic illnesses. So this is kind of an overview. It gives you some ideas about that. So first of all, I want to welcome you guys back to school. Welcome to the study of chronic illnesses, which is what we're doing in nursing this term. So first of all, let's define what a chronic illness is and differentiate that from an acute illness. So a chronic illness are diseases that are prolonged, do not resolve spontaneously, and are rarely cured completely. That's according to Lewis. Sometimes a person develops an identity around their chronic illness because it dominates their life and sets the agenda for their life so much. Quite often these illnesses continue indefinitely. Quite often there is no specific onset pattern. They might, some chronic illnesses have a sudden onset, some may be relapsing and remitting, and some may be characterized by exacerbations and plateaus. So in dealing with chronic illness, the focus of care is on the quality of life and symptom management, because typically with a chronic illness, cure isn't really an option. So here is a nifty link to the CDC that discusses chronic disease and gives you some cool infographics about chronic disease. So let's just sort of talk about the big one, the heavy hitters here in the chronic disease category, chronic illness category. Diabetes is a biggie. And you can see that it has a big impact on the US, over 29 million people, 7th leading cause of death. Alzheimer's disease affects 5.4 million people, and it is the 6th leading cause of death. Cancer is the 2nd leading cause of death. Coronary artery disease is the 3rd leading cause of death. That has since this currently been replaced by COVID. Stroke affects 7 million people, and it is a leading cause of serious disability and the 5th leading cause of death. And heart failure is the most common reason for hospitalization. So it's a very common problem. So let's look at some current statistics, morbidity and mortality of chronic diseases. This is an interesting little graph that illustrates the percentage change in this is the death rates for different chronic illnesses. And you can see that with some chronic illnesses, there's actually, this shows improvement over here. So there's been some improvement in reducing death related to these chronic illnesses through better understanding of treatment, more effective patient education, that kind of stuff. And whereas Alzheimer's disease, you can see, has really not improved at all and has become an increasing cause of death in the last decade. So let's look at Alzheimer's and dementia. So as I said, it's the 6th leading cause of death in all age groups, and 1 in 3 seniors die from this illness. The morbidity is the burden of disease enhanced because of the high level of dependence over a long period of time that these patients have. You know, usually there's a kind of a 10-year trajectory for Alzheimer's disease, and people become increasingly dependent over time. The caregiver burden for this condition is dramatic. There's an estimate that there's 18.4 billion hours of care provided by unpaid caregivers in the US. That's an estimate. and over $300,000 are estimated in lifetime costs for a person with Alzheimer's disease. So for diabetes, looking at the morbidity, mortality, and caregiver burden, with that, we'll look at each of these chronic illnesses in turn through the lens of mortality, morbidity, and burden. So with diabetes, the mortality is about 12% of deaths annually. It is thought to be underreported and may really be the third leading cause of death, according to the American Diabetes Association. The morbidity is 15% incidence of Americans over 20 have this illness, and the complications of diabetes are many. It's one of the leading causes of lower extremity amputations, for one. The burden includes CAD, coronary artery disease, stroke, hypertension, depression, pain, polypharmacy, functional disability, renal impairment, blindness, and loss of limbs. So these are all consequences of diabetes, and therefore are a burden for the patient as well as the caregiver. Cancer is the second leading cause of death. The mortality is 41% of those over 40, 46% of those over 70 worldwide. The morbidity, 9.4% of people get cancer in the US. Burden of cancer is the financial burden will increase as the population ages and is predicted to increase because of complex advances in treatment, which are expensive. For patients diagnosed with cancer in 2010, 69% survived the cancer for at least 5 years. That's why you see that's what that chart I was showing you earlier indicates. So you can see that the 5-year survival rate is approaching the target set by healthy people. So it is really improving with improvement in treatments. Coronary artery disease is the leading cause of death. It is, the mortality is, as I quoted before, over 300,000 deaths in 2017. Heart disease and stroke cause about 30% of those deaths. So that is lumped under the coronary artery ages. The morbidity is 18.2 million adults over 20. So that's how common it is. And the burden of coronary artery disease include costs of care, which are expected to increase by 55% by 2035. And complications include heart failure, heart attack, stroke, angina, arterial diseases. And we're going to learn a lot more about those as we go along this term. Stroke is sort of a subset of coronary artery disease, and the mortality for that is about 140,000 deaths annually. 1 in 20 deaths are from stroke. The morbidity is over 700, almost 800,000 people have a stroke annually. And the burden, it's the leading cause of serious long-term disability. Annually, the cost to victims of stroke costs and care are $34 billion in the US. And so you can see that takes a pretty heavy toll as well. Heart failure is another common chronic illness. 1 in 8 deaths in 2017 were from heart failure. Morbidity, about 6.5 million adults have heart failure. The burden is heart failure costs the nation about $31 billion in 2012. And the caregiver burden for those with advanced disease is significant. The disease course can be long and have a real up and down trajectory. Diet, exercise, medications are cornerstones of care and require careful monitoring, especially if there are several prescribing specialists involved. So this is really an important factor in chronic illness. And that's where the nurse typically plays a role as a case manager with chronic illness. For COPD, the 5-year mortality rate for people with COPD typically ranges from 40% to 70%. It's the third leading cause of death. Morbidity is more than 15.3 million people have been diagnosed with COPD. That is according to the American Lung Association. And the caregiver burden, the economic costs attributable to COPD were estimated in about 32 billion and were projected to increase to 49 billion by 2020. So that's this past year. So of course, as you know, these statistics are a little off because of the COVID pandemic, but I keep them here because once the pandemic has run its course, probably we will get back to closer to this these leading causes of death. So it's interesting that there's kind of a disparity in mortality rate across gender. So as you can see that historically, men were by far the most, had the highest mortality rate. And women have been gradually increasing. Well, they've kind of been holding the line at a steady state and sort of parallels the total number of deaths from COPD. But I thought that was pretty interesting that the there was such a big gap between women and men in the rate of death from COPD, but that is closing. So what are these chronic disease indicators? There is a uniform data set and indicators for measuring the prevalence of chronic illnesses. It's useful for surveillance and prevention strategies. So that is a big role that public health plays, is surveilling and preventing illness. 7 out of 10 Americans can expect to live several years with diseases before dying. So let's look at cultural and economic disparities of chronic disease. Chronic illness and disparities. So a disparity is if a health outcome is seen at a greater or lesser extent between populations, that's a disparity. So aging adults experience a higher risk of chronic illness. In 2012, 60% of older adults managed 2 or more chronic conditions. Health disparities exist among common chronic diseases such as hypertension, diabetes, HIV, AIDS, cancer, cardiovascular disease, obesity, with ethnic minorities and the poor having a higher incidence and worse outcomes. This has also been thrown into stark relief with the COVID pandemic and the people who have complications from that. There's a huge disparity there as well. Chronic illness and disparities, more about that. Americans with just 1 or 2 chronic illnesses in 2014 paid double the out-of-pocket cost compared with Americans without chronic conditions. So there's a huge financial burden. Americans with 3 or more chronic illnesses paid 4 times as much or more. Health promotion and disease prevention are needed today to reduce economic disparities along with racial and ethnic lines. So that's why we learned so much about health promotion in the first term, because it is the main intervention for preventing chronic illness. So here are some, this is just for your information. This is just shows you some different examples of cancer disparities, and you can see that there's a pretty dramatic difference across populations and ethnicities and race. Here is an illustration of how geography plays a role in heart disease incidence. And you can see it's very highly concentrated in the South and also in Nevada and also in the industrial area of Michigan. So that's a kind of, I thought that was pretty interesting. It really shows you the impact of location. So let's look at how COPD, some disparities with regard to COPD. Again, geography is a huge factor in incidence of COPD. And as you can see, it's really across the southern tier of states is where you see that most prevalently. So what is the difference between chronic and acute illness? So there's Lewis has a great description. An acute illness has a rapid onset and a short duration, such as colds, influenza, gastroenteritis, whereas a chronic illness is a disease that are prolonged and don't resolve spontaneously and are rarely cured. And there are some good examples in Lewis of that. So, and then there are some characteristics described here. So as you can see, there are, historically, acute illness was the main problem that people faced in terms of their health. But once antibiotics were invented, that became a less common problem. So infections were the leading cause of death for centuries until antibiotics were invented. So let's look at chronic health disease conditions in the U.S. And again, is the list that we talked about. So what are the risk factors for chronic health conditions in the U.S.? So thinking back to stress, ACEs, and chronic illness, you can see that stress is a huge predisposing factor for chronic illness. So as you recall, the ACEs, or adverse childhood experiences, there's a direct line between the number of ACEs a child has in young life and their likelihood of developing a chronic illness. And so what's interesting too about that is that the higher ACE scores lead to people's, it affects their health-seeking behavior. And so people tend to not report health, functional limitations, diabetes, and heart attacks. So quite often those conditions go untreated because they're unreported. ACEs are associated with leading causes of morbidity and mortality, again, because perhaps not treated. And although identifying and treating ACE exposure is important, prioritizing primary prevention is also important. So not getting too caught up in just tabulating ACEs, but trying to figure out how to prevent them. So what do you think about ACEs and their relationship with chronic illness? And what have you seen in your life? And do you see a line between those two? Alzheimer's disease. So the risk factors for Alzheimer's disease, a biggie is age, family history to some degree, cardiovascular factors can impact the risk of Alzheimer's disease. Diabetes and head trauma are the big risk factors, but age being the primary one. Risks for diabetes, a person might have prediabetes. Our obesity, are 45 years old or older, have a parent, this is type 2 diabetes, by the way, have a parent, brother, or sister with type 2 diabetes, are physically less active, and have had gestational diabetes. Race and ethnicity also are risks for diabetes. Heart disease, the risk factors there, you guys have seen all this over the years and know these over the past term, and you know these pretty well. High fat diet, inactivity, smoking, congenital defects, high blood lipids, hypertension, high alcohol intake, obesity, and diabetes. So there's a lot of cross risk, as you see, in these chronic illnesses. Cancer risk, again, age is a biggie, alcohol intake, cancer-causing substances like tobacco, hormones, immunosuppression can lead to cancer, is a risk factor for cancers. Infectious agents, obesity, radiation, sunlight, tobacco, diet, and chronic inflammation are all risks for cancer. Risk factors for stroke, the modifiable ones include blood pressure, hypertension, smoking, diabetes, diet, inactivity, obesity, hyperlipidemia, carotid artery disease, peripheral artery disease, and atrial fibrillation. Non-modifiable risks include age, family history, race, gender, and prior stroke or TIA. which is a huge risk factor. COPD, smoking is a risk, air pollution, breathing secondhand smoke, working with chemicals, dusts and fumes. Also, this genetic condition called alpha-1 alpha antitrypsin deficiency, and a history of childhood respiratory infections. All right, let's look at methods to prevent chronic illness. And this includes the different levels of prevention, as you may recall from winter term. So what do you think might be so what's the difference between a primary, secondary, and tertiary intervention? So let's look at that. So what we're trying to do with these levels of prevention is prevent disease. So the main focus of attack is preventative health behaviors, such as voluntary actions taken by individuals or groups to decrease the potential threat of illness. Again, there are the 3 levels. So as groups, this is what we're going to do in class, is figure out the different strategies. So here are some examples, which you can use as a reference. Also, examples for all these different diseases that we're talking about. So you can check those out. That's good information for you to have. So let's look at the trajectory model of chronic illness. So this is an interesting area of study. So with chronic illness, you don't just have an onset and then a rapidly dropping off set of symptoms because you get cured. You typically have an onset and then a plateau and then some kind of acute episode. Person will come back, they'll be stable for a while, they'll have another crisis, they'll be stable. So you can see it's kind of a stair-step trajectory where people stabilize, but they never come back to the prior level. So another way of thinking about chronic illness is describing them in terms of phases, where there's the onset, which is when signs and symptoms are present and the disease is diagnosed. There is usually a stable period where the illness course and symptoms are controlled and people are able to pretty much live their lives normally. And then there's some kind of acute crisis that happens. And that is when there's an active illness with severe or unrelieved symptoms and complications, and the person might be hospitalized at this point. And then the person will come back from that exacerbation. So that when you see a diagnosis with somebody who has an acute on chronic illness, that's what they're talking about. They have this chronic illness and an acute episode, which we used to call exacerbations. So then you will have a comeback, but at a lower level, and then another crisis. And that's quite often when there's some kind of life-threatening event that happens and emergency services are required. Then that is usually a tipping point for most people. And then they go through a period of instability where they're really not able to control the disease course. Their life is disrupted. Typically people at this point won't benefit from hospitalization so much as just trying to manage their declining condition at home. And there's a gradual downward trend as there's progressive deterioration and increased disability and symptoms and continuous disruption of everyday life. So once you hit these set of phases of chronic illness, this is when caregiver burden really increases. And then ultimately, a person's reserves are depleted and the disease takes over, and they enter the dying phase, which is where people typically at this point will withdraw from everyday life and interests, let go of there's a period of letting go, and that is not 100% with everybody, but quite often that will happen hours to days before death. So it's interesting because depending on what type of chronic illness, you might see some different trajectories. So for example, you can have, if a person has a very aggressive cancer, they might have a pretty stable condition. Quite often lung cancer is like this. And then just sort of drop off a cliff, start having severe symptoms, and then leading ultimately to death. Sometimes occasionally there can be a sudden death due to complications or exacerbations, and that can also follow this trajectory. However, you might have a condition where, like I described before, where there's an initial plateau, then an acute phase, and another plateau, and then another acute phase, but an overall downward trajectory until suddenly symptoms are very severe and it ends in death. And then with something like Alzheimer's or dementia, you have kind of a long, drawn out disease course. It just is a gradual downhill decline. So those are some different ways that you might see the illness progress. And if you think about people that you know who have had these conditions, you can see that this is pretty descriptive. So let's look at the 7 tasks of individuals with chronic illness according to Corbin and Strauss. So this is pretty interesting. This is a model that was developed by these two researchers. It's a nursing model, and it really is predictive of the tasks of people that are chronically ill. So initially, one of the main tasks is to prevent and manage a crisis. As you see from the illness trajectory, that is a feature of chronic illness. Another challenge is to carry out the prescribed treatment regimen. So quite often people will have an initial period of stability where they're managing symptoms with their treatment regimen. And then as the condition becomes more complex, that can become more difficult. Also, the person will, another task is to try and control the symptoms, because as we know, these conditions aren't curable, but that is a focus of the chronically ill person. People will have to reorder time, which means they have to readjust their schedule to adapt to their illness and the demands of their treatment regimen. And then also, a person who's chronically ill will have to make adjustments and changes throughout the course of the disease as their functional ability diminishes and their reserves diminish and the symptoms become more dominant. And another huge task for the chronically ill person is to prevent social isolation, because so much of their energy is taken up by just managing the illness, and attempt to normalize interactions with others. So that's another big task for this category of illness. So because most chronic illnesses have the potential of an acute exacerbation of symptoms, one of the big focuses of managing chronic illness is preventing and managing crises. So we'll talk about these a little more in more detail. So another task is carrying out prescribed treatment regimens, and that varies in degree of difficulty. Like, for example, somebody with diabetes, they have to have a blood glucose monitoring regimen, they have to have a medication regimen, they have to regulate their diet. There's many pieces that are required for adequately managing this chronic illness. And another important task is to control symptoms and help regulate their onset, duration, severity. Reordering time, we already talked about that. Adjusting to changes throughout the course of the disease, preventing social isolation, and attempting to normalize interactions with others. So trying to maintain some sort of contact with the outside world. So we talked about that already. So let's look at how body image and stigma and social isolation relate to chronic conditions and diseases. So what is stigma? Social stigma is the disapproval of or discrimination against a person based on perceivable social characteristics that serve to distinguish them from other members of society. So a chronic illness could be a source of stigma, can negatively affect body image, mood, and risk-taking behavior. Being a person who feels stigmatized can have that effect. Body image is defined as your mental image of yourself, including physical appearance and functioning, and social isolation, which is another feature of stigma, is a state of complete or near complete lack of contact between an individual in society. So here are some examples of that. For example, if somebody is disfigured by an acid burn, they will be somebody who will feel stigmatized because of their scarring, especially around the face, and will withdraw from society. And AIDS is another good example of this. So think about that. What have you seen? How do you see stigma playing out with chronic illness? So there are just some examples that I was able to research, such as with COPD, people are stigmatized because of their behaviors. People often feel like they're at fault for developing this illness, and also having to lug around an oxygen canister can be stigmatizing because it makes you different from everybody else. In heart disease, again, there's often blaming because people are thought to, be lazy or have poor diet control, poor self-control. Quite often, depression and body image are affected by stigma. In cancer, fear, isolation, and a distancing of friends quite often occurs with this condition. A lot of times people will experience a loss of control and judgment about lifestyle choices. With stroke, there are physical changes, communication barriers, and stigma affects rehab success because there's quite often a lot of anger and grief associated with a stroke. In diabetes, again, there's blaming and body image because people are thought not to manage their blood sugars well or their disease course well. And with Alzheimer's disease, people make assumptions about their debility, and that can be a barrier to seeking and getting appropriate care and seeking appropriate quality of life. So let's look at some disparities. And we talked about this already a little bit. What do you think about it? Here's just a graph that shows the prevalence of diabetes, which is a chronic illness, and the prevalence of insurance. And as you can see, people with diabetes are less apt to be insured. You can see over here, people are more insured that outside of this chronic illness. So that's what that graph is meant to illustrate. And because people typically don't have insurance, quite often they're more apt to get diabetes. So you can see that there's a concentration between those two, lack of insurance and incidence of diabetes. Let's talk about disparities and impacts on health disparities and chronic illness. So some examples include ethnicity and race, where you live, income, education, occupation, health literacy, gender, age, and sexual orientation. So let's look at how illness differs from disability. So this is a pretty interesting way to think about this. So an illness is a subjective experience of ill health, whereas a disability is a disability is someone who is disabled is a person who has a physical or mental impairment that substantially limits one or more major life activity. So there is an overlap here. People can be ill and also be disabled, but people can be disabled without being ill, or they can be ill without being disabled. So as you can see, illness is a more global term. It encompasses both disease and sickness. So some features that differentiate illness from disability. With chronic illness, there's there's that stair-step trajectory that we looked at. Might not be able to tell that somebody's chronically ill by looking at them, and it may not restrict a person, at least in the early stages, restrict their ability to participate in activities, whereas a disability is typically very evident, is restrictive and participating in activities. The disabled person may not be ill. Usually there's some kind of accommodation that's required to allow participation in activities. Oops, left the S off of there. And the thing about disabilities is they're often externally evident. So that is what I have to say about chronic illness, part 1. Thank you for listening.